Welcome everyone. In this video, we would focus on some common terminologies in epidemiology. Okay, so I will try my best to explain in very simple, practical, and a memorable way with real-world examples. I will give you several examples to help you remember. Let's begin. We will start with isolation. Now, in epidemiology, when we say isolation simply means separation of infected individuals from healthy ones to prevent disease spread. Okay, so when we say isolation in epidemiology, it simply means the separation of infected individuals from healthy ones to prevent the spread of a disease. Okay, so in epidemiology, if you hear isolation, we usually isolate sick people. Okay, and then we have another word we call quarantine. Quarantine has got to do with restricting movement of people who have been exposed. So if you get to know that someone have been in contact with an infected person, someone who has been infected with a disease, okay, we quarantine those people. So those people, they are suspects. So we quarantine them. We quarantine them for some time. Is that okay? We quarantine them for some time. So in epidemiology, we isolate infected people and we quarantine suspected people or people who have come in contact with a disease or have come in contact with an infected person. Or sometimes we say people who have been exposed. Is that okay? Great. So that is the difference. So isolation is just separation of infected individuals from healthy ones to prevent disease spread. Okay, an example can be that a patient with COVID-19 staying in a separate room until they are no more or they are no longer infectious. That is an example. Okay, it's an example of an isolation. Another example can be hospital isolation wards for patients with tuberculosis. You know, in some hospitals, they have isolation wards for patients with some infectious conditions. So the key point is that we isolate people who are sick. Okay, isolation is for sick people in epidemiology. Okay, then we have quarantine. Quarantine is about restricting movement of people who have been exposed but are not yet sick. That's the key thing. People who have been exposed, people who have come into contact with people who have an infection or a disease, but they are not yet sick. So we quarantine them. We usually use the maximum incubation period when we are deciding or you are confirming the date or the period of the quarantine. We use the maximum incubation period for the kind of disease the person was exposed to. Is that we use the maximum incubation period. Okay, so usually for quarantine, and we can ask you that in exam. So during quarantine, how do we usually quarantine people? We use the maximum incubation period. Okay, so quarantine is about restricting movement of people who may have been exposed but are not yet sick, usually for the maximum incubation period. An example can be travelers exposed to monkeypox. Okay, they are being asked to quarantine for 21 days. So if you're a traveler, you are coming from an area where monkeypox is, let's say, has become an outbreak or an epidemic, we can ask you to quarantine for 21 days. That is an example of a quarantine. So we quarantine people who have been exposed, but we isolate people who have the disease. Okay. Another example can be family members exposed to a measles case, staying home to watch for symptoms. That is also an example of a quarantine. Okay. Now, the key point you should understand with quarantine and isolation is that quarantine is for people who have been exposed or people who have come into contact with infected individuals. Isolation is for sick people. Okay, good. So quarantine is about restricting movement of people who have been exposed. Isolation is also about separation of infected individuals from healthy ones to prevent the spread of a disease. Now, the next terminology we will look at is what we call prodromal period or prodromal signs. Okay, now prodromal period or prodromal signs. This has got to do with early symptoms or signs that indicate the onset of disease before the more specific clinical symptoms appear. Now, for some infectious conditions, we usually have what we call prodromal period or prodromal signs and symptoms. Now, but prodromal signs and symptoms are more like the early onset, the early signs that usually appear before the person actually gets the disease, or before the person actually begin to experience or manifest the specific clinical signs of a particular disease. Such signs are what we call the prodromal signs. There are some conditions that before the person actually begin to experience the clinical signs, the person may experience fever and headache. So the fever and headache may be the prodromal signs. Okay, we call that prodromal signs. So they are more like the early vague symptoms before the specific disease signs, the specific and the most cardinal signs of the disease itself appear. Okay, so we have some infectious diseases that before the clinical signs, the most specific clinical signs appear. Some signs appear before. Those signs that appear before the specific clinical signs appear, we call those signs prodromal signs in epidemiology. Okay, so for example, fever and fatigue before malaria attack. Usually, before people experience the actual signs of malaria, fever and fatigue will usually begin. Sometimes fever and general body weakness, they will be the prodromal signs before. So if you are communicating with someone, you say, oh, prodromal signs of malaria, meaning the signs that will appear before the very specific clinical signs of malaria itself begin. Okay. Another example can be tingling at the lip before a cold sore form. Okay, that can also be considered as a prodromal sign. Now, the next terminology we'll look at is etiology. Etiology. What is the meaning of etiology? Etiology have got to do with the cause or origin of a disease. So etiology simply, you can also explain it as the study of the cause or origin of disease. For example, the factors and mechanisms that lead to a healthy condition. So etiology has got to do with why a disease happens. In simple terms, etiology, why? What's the cause of the disease? What's the origin? Why is the disease occurring? So it has got to do with the organism behind the occurrence of the disease, the various factors. It could be environmental factors, it could be behavioral factors, cultural factors. It could be so many factors behind the occurrence of a disease. That is what we call etiology. For example, Streptococcus bacteria as the cause of strep throat. Another example can be smoking as a factor or a cause for many lung cancer diseases. Is that okay? Okay, so etiology has got to do with the cause or the origin. It could be the factors, okay, behind the occurrence of a disease. Now, the next thing we will look at is what we call measures of association or measure of association. Okay, now a measure of association is more like a statistical term. It's a statistical term that quantifies the relationship between an exposure and an outcome. Okay, so in epidemiology, we have measures of association. If you hear measures of association, we have risk ratio, we have the odds ratio, we have the rate ratio. Is that so? Measures of association, they are statistical terms that epidemiologists use to measure the relationship between exposure and an outcome, more like diseases and the risk factors. So they are statistical terms that helps epidemiologists to understand the relationship between diseases and the factors behind the occurrence of those diseases. Okay, for example, smokers have a risk ratio of 10 for lung cancer versus non-smokers. Another example, odds ratio showing the unsafe water is strongly associated with cholera infections. Is that okay? Good. Then we have risk factor. Risk factor simply means anything that increases the likelihood of the occurrence of a disease. Anything at all that increases the likelihood of a disease. Okay, so risk factors, if someone falls within a risk factor, it raises your risks or the chances of getting a particular disease. Okay, so risk factor is a characteristics, exposure, or a behavior that is statistically associated with an increased probability of a disease. That is a risk factor. It's a characteristic, exposure, or a behavior that is statistically associated with an increased probability of a disease. That is what we call a risk factor. Okay, so a risk factor is more like anything that increases the likelihood of the occurrence of someone acquiring a disease. Is that okay? An example can be high blood pressure is a risk factor for stroke. Yes, and we all know that high blood pressure is a risk factor for stroke. Okay, you can even say that unprotected sex is a risk factor for HIV/AIDS. Do you get it? Unprotected sex is a risk factor for HIV/AIDS. Okay, good. Now, another thing that we would look at, the next thing we will look at is what we call causal inference or causation. In epidemiology, we have these terms, very interesting, causal inference or what we call causation or disease causation. Now, causal inference basically is about determining whether an observed association truly shows cause and effect. Okay, it's more like correlation is not always a causation. There are times that you see certain factors are associated with the disease, but it doesn't always mean that that factor, if someone is having it, the person will end up developing the disease. Is that okay? That is all that association causation is about. So the ability to draw conclusions about the cause and effect relationship from observed associations, often using criteria like temporality, strength, and consistency. Okay, for example, determining Zika virus infection causes microcephaly through consistent evidence. Okay, so causation is always very important, or causal inference is very important. It will help you to, be very patient to get enough evidence before you draw conclusion. Causal inference. So causal inference is about your ability to draw conclusions about the cause and effect relationship from observed associations. So it's always very important that you observe a lot of factors or a lot of evidence before you make conclusions. Is that okay? Good. So that you can make very strong, and then it will help you to be consistent in terms of any associations or conclusions that you make. Okay, that is it about causal inference. And the reason why causation or causal inference is important is because it's not all the time. Okay, correlation is not always causation. Okay, so it's very important that you determine whether an observed association truly shows cause and effect. You take your time to look at other factors to be sure that the associations you've observed, truly, those associations really depict cause to effect relationship. Okay, we have the next term that we will look at, eternal validity. Eternal validity. Okay, in epidemiology, we have what we call eternal validity. We even have another one we call external validity. Okay, we have eternal validity and we have external validity. Now, when we say eternal validity, what does it mean? Okay, when we say eternal validity is about how accurate or trustworthy a study results are for the participants that you studied. Okay, so if you do an epidemiological study, how accurate is the results? For example, you've done an epidemiological study, you've come up with some findings. How accurate is the findings that you have? Okay, the accuracy of the findings from an epidemiological study or even a research, that is what we call eternal validity. Is that okay? Then we have external validity. External validity is what we sometimes call generalizability in epidemiology. The ability for you to generalize the findings or the results from a particular study to another population. That is what we call external validity. Okay, but internal validity is about how accurate and trustworthy a study results are for the participants that were studied. Okay, so eternal validity asks like, did we get it right? Eternal validity is about, okay, you've done a study, the results, did you get it right? That is eternal validity. Is that okay? So for example, a randomized control trial that prevents bias has high eternal validity. Okay, also a survey with a poor sampling and missing data has a low eternal validity. So eternal validity is about how accurate and trustworthy a study results are for the participants being studied. That is what we call eternal validity. Okay, but when we say external validity, that has got to do with the ability for you to generalize the findings from a study to another population. That is what we call, or another setting. That is what we call external validity. In some literatures, they call it generalizability. That's the same as external validity. But eternal validity is about how accurate and trustworthy a study results are for the participants that are being studied. Now, the next terminology we will look at is what we call portal of entry. Portal of entry. Portal of entry is very simple. It simply means how a pathogen enters the host. So when we say portal of entry, in chain of infection, we have that term in chain of infection. So in the chain of infection, we have the portal of entry, how a pathogen enters the host. A pathogen can enter the host through the mouth. Some pathogens can enter the host through the nose, through the eyes, through a cut in the skin. Okay, so how a pathogen enters the host, that is what we call portal of entry. How a pathogen enters the host, that's what we call portal of entry. Okay, so example, respiratory droplets entering through the nose. So there are some conditions that they are as a result of respiratory droplets who have their way through your body through your nose. We also have malaria parasites entering through a mosquito bite on the skin. Malaria parasites entering your body through a mosquito bite on the skin. Is that okay? So when we say portal of entry simply means the site through which a pathogen enters the host. Example, it could be mucous membranes, it could be the skin, it could be the mouth, the nose, you get a cut in the skin. Is that okay? That is what we call portal of entry. Okay. Previously, we even have what we call the portal of exit. Portal of exit have also got to do with how a pathogen leaves a host. That's what we call portal of exit. Okay, and all this is under chain of infection. So the chain of infection, we have the susceptible host, we have the pathogen, we have the portal of entry, we have the reservoir, we have the mode of transmission, we have the portal of exit. So the susceptible host, it could be an elderly person, it could be an infant, it could be an immunocompromised person, it could be anybody. We have the pathogen. A pathogen can be a bacterial behind the occurrence of a disease, a virus, a fungi, a parasite. Portal of entry is how an organism, a pathogen, enters the host. It could be through the mouth, it could be through the nose, the eyes, cut in the skin, mucous membrane. Okay, we have a reservoir. Reservoir basically means someone who harbors the organism, someone within which the causative organism lives, the pathogen lives. It could be people, it could be a person, it could be an animal, it could be within the soil, it could be within food, it could be within water. Okay, all these can be reservoirs. Okay, then we have the mode of transmission. Mode of transmission, some conditions have a direct can be as a result of direct contact. Some can be as a result of indirect contact. Some can be as a result of vectors. Some conditions are transmitted by vectors. Okay, then we have the portal of exit. Portal of exit is how the mechanism through which a pathogen leaves the host. That is what we call portal of exit. The route or the mechanism through which a pathogen leaves the reservoir. Some organisms, they leave the reservoir through coughing, through sneezing. Okay, for example, cholera leaves through contaminated feces. Do you get it? So portal of exit has got to do with how a pathogen leaves the host. How, the mechanism or the route through which an organism leaves the host. Okay, that is what we call portal of exit. Is that okay? Good. Example, influenza lives through coughing and sneezing. Influenza lives through coughing and sneezing. Cholera lives through contaminated feces. Now, the next thing is infection. Okay, infection. Entry. Infection has got to do with the entry and multiplication and establishment of an agent in the host, which may or may not lead to a disease. Now, simply put, when we say an infection, it has got to do with the entry and multiplication of an agent inside the host, with or without symptoms. Sometimes people are infected, but they don't show any symptoms. Now, during the COVID-19, you might have heard them saying people got the infection, but they didn't show any symptoms. Okay, you can have the same infection with someone, the person will not show any symptoms. Okay, infections does not always mean disease. That's one key thing you should remember in health. Infection does not always mean disease. Okay, so infection has got to do with the entry and multiplication. A pathogen can enter and multiply, but the person will not show symptoms. So if you are defining infection, it's about the entry and multiplication of an agent inside a host with or without symptoms. Is that okay? Because you see, example can be many people infected with COVID-19 were infected with COVID-19 but did not show any symptoms. They were asymptomatic. Do you get? Another example can be carriers of hepatitis B without symptoms, with no symptoms. Do you get it? And that is very common. Okay, then we have infectious disease. When we say infectious disease, a disease caused by a pathogen and can spread from one person to another. You know, we have infectious disease, or how we call communicable disease, and we have non-communicable disease or non-infectious disease. So when we say infectious disease, a disease caused by a pathogen and can spread from one person to another. Example can be tuberculosis. We can even have chickenpox. Okay, these are what we call infectious disease. Now, the next terminology we'll look at is what we call case fatality rate, CFR, case fatality rate. Case fatality rate basically is the proportion of individuals diagnosed with a disease who die from that disease within a specified time period. Okay, so case fatality or CFR, the proportion, simply put, you can say the proportion of diagnosed cases who die from the disease. Now, get the difference. This definition is not about proportion of people who are infected who die from the disease. We are specific over here, proportion of diagnosed cases. Okay, because we have another terminology that we call cause specific mortality rate. Okay, that one has got to do with proportion of the people with the disease who die. That is different. Okay, this one we are talking about case fatality rates. This one is specific to the proportion of people diagnosed of a particular case who die from that disease. It shows how healthy, in fact, this particular rate shows how deadly the disease is once you get it. It will help us to understand, because see, if we take, let's say, 50 people who are diagnosed of malaria and let's say 30 of them died, it tells us that then the disease is very deadly. Because if you have 50 people and 30 people died out of the 50 people, 30 people were diagnosed. 50 people were diagnosed, 30 died out of those diagnosed. That's what we call the case fatality. Case fatality will let us know how deadly the condition is, so that if someone gets the disease, we can at least predict the prognosis that this is how it will end, or it is likely to end. It helps us to know how deadly a disease is. So if we tell you that Ebola, the case fatality rate of Ebola is 50%, it means that if 10 people should get Ebola or should be diagnosed with Ebola, 5 of them will die. That's the meaning. So if you happen to get a condition, then you have to be very careful with adhering to treatment, or someone suffers the condition, then we have to be very proactive. Okay, good. Now we have another terminology we call the age-specific mortality rate. Age-specific mortality rate. Okay, age-specific mortality rate has got to do with death in a specific age group. Example, mortality rate among adults is 65 years and above. Okay, great. Then we have infant mortality rate, infant under 1 year. Okay, we also have crude mortality rate. That is the overall mortality rate in a population without adjustment. Okay, now example can be total deaths per 1,000 population, countrywide annual death. Okay, so crude mortality rate is the overall mortality, the overall people who have died out of all kinds of condition. That is what we call crude mortality rate, the overall mortality in a population without any kind of adjustments. Okay, so crude mortality just look at the overall mortality. We don't pay attention to any particular or a specific cause. Is that okay? Then we have what we call attributable risk or attributable proportion. Now, an attributable risk or attributable proportion is basically the difference in risks between exposed and unexposed. It shows how much disease could be avoided if the exposure was removed. Okay, so in simple terms, attributable risk points to the preventable risk. It points to the factors that should be controlled. Is that okay? Example, if smokers have 20% lung cancer risk and non-smokers have 1% lung cancer risk, attributable risk, okay, then it tells us that if we are able to control smoking, okay, we would be able to minimize the occurrence of lung cancer, because you see, smokers are having 20%, lung cancer risks. Non-smokers are having 1%. It means that the disease is very common among smokers. Okay, so attributable risks or attributable proportion, it helps us to identify the exposures, the possible factors behind the occurrence of a disease. Is that okay? Great. Now, the next terminology we are going to look at, we will look at screening, we will look at sensitivity, we will look at specificity, we will look at gold standard, effect modification, ecologic fallacy, morbidity, mortality, or mortality rate. Okay, for now, we will end here for today's section. Okay, all right, so continue to support the channel. You can subscribe to the channel, share content on the channel to your friends and your family, people who may find content here very likely. Share it with your colleagues, especially those in the health profession. I wish you all the best. Catch you in the next video. Bye bye.